Welcome back to the Run Radio podcast. My name is Trina Wilcox, and my guests today with Healix Infusion Care, Angie Wigman and Amber Hobbs. Welcome.
No, I'm Amber, and that's Isabella, actually.
Hi. Isabella, you tricked me. We've never got to meet face to face, so I've been talking to. Okay, well, welcome, Isabella.
Happy to be here.
I apologize for my skin issue. We're just going to brush over that and pretend. I tried to dim the lights. Nothing helped. So I apologize.
I think you look great.
Thank you. I appreciate that. I want to know all about Healix Infusion Care because you sent me some pictures earlier and I'm like, am I looking at a fancy loft? I would like to move in here, please.
Right.
So tell me about what it is and what you do for patients.
So Healix Ambulatory Infusion Center. So we have 3 locations in St. Louis right now and 3 more in Pennsylvania, but we're going to focus on St. Louis ones today in this conversation, right? We have locations in Brentwood, Missouri, Ellisville, Missouri, and then O'Fallon, Missouri. And they are more like a spa type setting with, as you can see, fancy leather chairs, blankets, more of a, snacks and drinks and all that great stuff. We have a really patient-centric staff, and that's the idea.
I mean, for anybody that's ever had an infusion, even if it's really not for something major, it feels major, and it doesn't feel good to feel sick. So if you can be in a setting where, like you're providing, where it's more fun and you're in that positive space, well, you're going to heal better anyway. They say how much that can make you heal and get through stuff so much better. But where did this stem from in the first place? What made you think, hey, this is something that people would really benefit from?
Well, we do want to be a differentiator in the market. And like you said, it's a stressful situation when you do have to get an IV therapy and you're already stressed out about insurance issues and the medication and the side effects. We just really wanted to make it designed for the patients in mind. And so we wanted to have that feel when you walk in that, this place, they understand what you're going through, you're supported. We want this to be something that you don't dread, but it is something that the patients really feel at home.
How did you get involved with the Arthritis Foundation?
Well, fortunately, Isabella has done a great job. So she's operations manager and a pharmacist here on staff. There's a huge staff, not a huge staff, but there's a lot of people here that work that have a lot of different roles, including we have an NP on staff, Elise, and she is our nurse practitioner, goes over all the nurses that we have here at the at Healix. How we got involved was that we had a discussion with our staff that we thought not only should we be with the doctors and the patients, but we should know all about the foundations and what they do. And so Isabella started reaching out to Dolores, and she was fantastic and came to meet us and came to our events. I think our first event last year was the Jingle Bell Run, and we had a booth there and met patients, and that's how we kind of got started.
Yeah, we just really want to support our patients in that community. So
yeah, I think that's very smart and wise to do, because for you to know them, it means they get that opportunity to know about you, because I think we had a brief conversation about how, patients aren't always privy to what all is available to them. And
right.
One of my passions with working with chronic conditions and the Arthritis Foundation is making sure the advocacy is there and that the resources are available to patients and their caretakers. So what is it that a patient needs to know that you can provide for them, and how to find out?
So communication is huge for us, right? So we'll let them know that we have an order that was sent over from your doctor's office. We'll ask them, if there was any insurance changes, and then they'll know at that point, we're going to look at the benefits and verifications. There's a prior authorization that needs to be done, and then we'll get back to you with if there's any out of pocket, any estimate for that. With that in mind, we try and go above and beyond to make sure they're enrolled in any patient copay assistance programs that manufacturer of that drug may offer, if there's foundation help that they may need. So we want to make sure that they're comfortable with that situation. And then we let them know what to expect and how to be hydrated, where we're located, how easy the parking is, who they'll meet there, forms that they'll have to fill out, so that they know exactly what's happening. So we really do think that we are trying to be like that patient advocate for them.
Mm-hmm. So I know it says infusion care. Are there other things that you do, like simple draws or something like that, that patients need to be aware of that you can do for them?
So at this point, we are focused on chronic illnesses, which we do sub-Q injections and then the infusion drugs.
Okay.
We also do some wellness.
Okay.
More like, we call it just a splash, hydration type things, vitamin B12, vitamin C, that kind of stuff as well. We can do the lab draws for a patient if we have the specific order from the physician. We send them to Quest. We don't do that here, but we can do the lab draw while you're having your infusion done here at the center.
Okay. And you said something about insurance. So my first thought when you look at how beautiful your facility is, oh no, I can't afford that. That's not for me. But that's not the case, is it?
Right. We'll do whatever we can to find any outside help. So if it's like a foundation, so maybe the Arthritis Foundation might have something, or some other, either from the manufacturer or disease state or whatever it may be. So we will look through, and that'll be on us to find any help that you may need. Yes.
Because we're considered a site of care. Actually, in some instances, there's a couple different levels of infusion centers. I'm sure that you seem like you're versed in as a patient yourself. So there is an in-office setting, there's a hospital setting, and there's an ambulatory setting. And there's also home infusion, right? So our setting is ambulatory, not home infusion. And with the ambulatory sites, usually it's actually less expensive to your insurance company than home infusion or even a hospital infusion.
And we don't have facility fee.
There's no facility fee as well. Yes.
Oh, okay. Interesting. So how, other than, things like this, podcasts like this, is there a way people can dig around and find out about this stuff? I feel like it's just not.
This concept actually is, you seem like, well, I don't know, but it's brand new. An ambulatory unit of this level and this beauty and this patient centric is new. It's a new concept. So we wanted to, last year when we opened in March was 1 year of the O'Fallon office. The Ellisville office opened in July, and then this office opened in November. So we literally have been a year. And you asked me earlier, we that's what we did. We went out really, and I don't want to say knocked on doors, but kind of did. We told all the different reps. We talked to the foundation people, and we're like, listen, come and see our spot, because once you see it, you'd be like, oh, why would I not come here? We're like, why would you not? Right.
Really?
And that's really been, it's really snowballed. It's really helped us to, once patients come, tell their friends. Once patient maybe comes for, let's say, a very basic sub-Q injection from one physician, might be here and say, well, can I get my other stuff here done as well? Yeah, all on the same day. Usually, right? You can have one visit and come and have a savings that way. So, and I don't know if I discussed about Healix Infusion itself. Healix, for the past 35 years, has been a infusion center in office settings. So if you were a rheumatoid doctor and you wanted to have your own chairs, Healix was a company that came in and managed with you. They hired the nurses, they trained the nurses, they help procure the drug, they help that cost, because the drugs are really expensive. And they help do the prior authorizations, and they help do the insurance billing, and they help with the doctors to manage their office. What happened though in the past 5 years, we've seen insurance really change, and we knew this was a untapped source that needed to be dealt with. And we were the ones to really had the knowledge. We really had all the ducks were in a row. We just needed to find the spots. And so we started in St. Louis, and we started in Pennsylvania to kind of be test ground, I guess. But it's really going well, and we foresee in the next 2 to 5 years to be branching out, going on into Illinois, maybe down southern Missouri, maybe towards you. I know you live in Springfield, correct?
Yes.
So that area, hopefully. So be on the lookout.
That's right. What's it been like to watch patients come through the door and share some of their testimonies with you?
It's been wonderful. We have a great nursing staff. And so they're there, they're listening to all the stories. Their bedside manner is wonderful. They're engaged, they're hugging. They know more about our patients than we know about our cousins, right?
Yeah.
So, I mean,
We even have gone as far, our nurse, when she first started with us, we had a patient who liked Oreos, and so she made sure Oreos were there for her.
Aw.
And that seems kind of petty, but isn't it? It's very important, right? If that person's coming and maybe spending 3 to 5 hours with you in a chair watching television or just taking a nap or whatever they're doing, right? To know that somebody thought of you and thought to, hey, I know you like these Oreos, here they are. It's a blessing.
It is.
but we understand the quality of life is an issue. It's very symptomatic. And so we do as much as possible with the chairs and the blanket, like you said, to really show them the support that we're here for them and the understanding.
Have you seen all ages come through? Is it just one particular age demographic, or do you see kids?
Yeah, we have young children. I mean, we've got our children, we have adults.
Yeah, right now, again, it's only been about a year, so we've been actually going. So really, we see mostly adults, but we are starting to branch off into having. Right now, we're at adult-sized pediatrics, so children who are maybe 12, that kind of thing,
Yeah.
But we are actually recently have hired nurses that were actually more open to the conversation of having pediatrics. So I am hot on the trail to find some of those. I know that St. Louis is going to have the pediatrics arthritis summit right here in St. Louis, I think. So I'm definitely going to reach out to those people there to know that we are available.
Good.
We have a family room.
Yes, that is what. Go ahead and talk about that too.
Yeah, so we really do try again to cater to our patients' needs. And so I believe just the other day we had a patient with a young baby. And so we just kind of put them in a private room. We offered, anything that they may need. And so we are welcoming anybody to come in with a caregiver, or if they have young children, and we'll do as much to accommodate them.
About how many patients can you facilitate at one time?
Well, we have about 7 chairs at our 3 offices. So we just space them out and trigger them or stagger them. So we're able to accommodate. We're doing a really good job of being able to get patients in as quickly as possible. We've got to get to my patients.
Do you have certain operating hours, or do you just do by appointment only? How do you do that?
We're pretty much 8:30 to 5.
Yeah.
Evenings and weekends by appointment only if it's necessary. We try to accommodate patients different ways if we can. Monday through Friday, yes. And that's where we're at this point in time.
What else do you want to share? This seems really exciting. I'm glad that you guys are sharing this, and it seemed to be catching on. It seems like it's going to be doing really well.
We've had a great response, right? I mean, just like yourselves, or when people walk in, they think they know what they're going to see, and they come around those corners, they're like, wow. I'm like, yeah. It's very fun to come and to work at a place where the environment is so wonderful and the staff is so great.
Yeah.
I encourage anyone who's interested to helixinfusion.com, to our website, peruse where it says, for patients, and they'll kind of drop down to have different areas you can look into and think about. We have what we call an open formulary. So, some hospitals only have certain drugs. And that's one thing about Healix, we don't have that limitation. So even if a new drug comes out, we're on the forefront of many drugs, maybe not necessarily in this conversation, but other ones that are coming that we're the first ones in town to have it. So it's a great feature, and I think a wonderful opportunity for the St. Louis area at this point in time, right?
And we just want to share our support. So if you see us at an arthritis walk or an event, we'll be at the booth. Just please come by. We love to sponsor it, and we love to share our support.
We give out free bags and free water bottles and, little lipsticks, right? So we're there.
Good swag is everything,
Yes.
right? I mean, it's one thing to be a great caregiver in a given situation, but when you can be a great caregiver in a great situation and just everybody's spirits are lifted up, it's just going to be a better outcome. And so it looks like you guys are doing that and doing it well. So thank you so much.
We would love to invite you to come to the center sometime. If you're up in St. Louis, please let us know. Stop by. We'd love to give you the tour of the centers and let you
I
see
would
what's going on.
love that. Thank you so much for sharing your time. Tell people again one more time the website so they can go check you out.
HelixInfusion.com.
And that's
And Helix,
HEALIX.
infusion.com.
All right. Thank you so much for sharing your time and what you're doing for the community. Appreciate it.
Well, thank you so
Thank
much for having
you.
us. We had a great time.
Yes.
No problem. Be sure you're following along the Arthritis Foundation of Missouri and the episodes like this at runradio.net.